Welcome to the pop, stop and drop technique. Key principles of IV cannulation for novices. Firstly, it is essential to understand the cannula structure. Starting from the back, there is the cap, which sits on the hub, where you will notice the so-called flashback of blood, just behind the injection port. Underneath the injection port on both sides are the wings, which may be folded up. It is also important to make sure that these are flat when you insert and stick down the cannula. Moving further down, you can see that the middle of the cannula is taken up with the very sharp pointed needle, which has a bevel to it, and it is absolutely crucial to appreciate that the plastic cannula starts well beyond the point that the blood entry starts. Let us take a closer look at the sharp end of the cannula, emphasizing once more where the plastic cannula starts versus where the entry of the blood starts. This slide demonstrates the sharp tip of the cannula entering the vein. It is important to notice that at this point you will get the so-called flashback into the hub, but that the plastic portion of the cannula is still within the subcutaneous tissue and nowhere near to entering the vein. A quick side point is to notice that the insertion angle should be no more than 15 to 20 degrees. In bigger veins, it'll be more on the 20-degree side, and in thin, very thready veins, such as in the elderly, it will be closer to 5 degrees with a longer subcutaneous trajectory. There is not much to say on this slide other than that the body conserves heat by vasoconstricting superficial vessels in the skin. Those are the veins. So, cold veins are vasoconstricted veins, which will make your job of placing a cannula, especially in small thready veins, much more difficult. In the cold hand situation, it may be worth getting the patient to warm up their hands by wrapping them in some warm clothing or blankets, or indeed immersing them in some warm water while you step away for 20 minutes to half an hour and come back. Immobilizing or fixing the vein prior to trying to insert your cannula is important. As you can see from this slide, longitudinal immobilization through the application of tension is the best way. This results in the least collapse of the vein. You can see in the lateral squeeze slides that when you squish the hand from side to side, it results in squashing and flattening of the vein. When tensioning the vein, it is important to keep your tensioning thumb far enough back from the point of insertion into the vein so as not to interfere with dropping your angle once you have entered the vein. Now, the way to hold the cannula. The technique demonstrated in this slide gives both stability and maneuverability, while most importantly allowing you to have clear sight of the hub into which you expect to get the flashback of blood. Note also that the middle finger down to the little finger are curled away from the cannula, allowing you maneuverability and freedom. It may feel initially like there is no stability or you're about to drop the cannula, but I assure you that with enough practice, this will cease to be the case and you will see that it is quite stable and maneuverable. The angles of insertion. It is important that you try to line up the angle of your cannula as exactly as possible with the direction of travel of the vein. This will reduce the chances that you cut across the vein, either missing it entirely or entering it and exiting it through a side wall. Note the longitudinal tension with the tensioning thumb well out of the way of the cannula in preparation for the drop stage once vein entry has occurred. The second picture shows the attack angle of the cannula, which should be around 15 to 20 degrees. Obviously, it will need to be flatter with a longer subcutaneous trajectory in very thin, small veins. Please review the cannula structure, noting that the plastic cannula starts well behind the point where blood enters the needle. There is a subtle but detectable pop that comes with experience. Please note that the rapidity of flashback of blood into the hub of the cannula depends on the size and back pressure within the vein. The small and thready veins, the flashback is likely to be more sluggish and require you to not advance once you have felt the pop until you have seen this sluggish flashback into the hub. Whatever happens, once you have seen the flashback in the hub, you must stop advancing the needle. Once you observe the flashback into the hub, just stop. Do nothing more at this point. Again, it is important to notice that the plastic cannula is not within the vein. Now we get to the drop. The purpose of dropping the back of the cannula down to a lower angle of approximately 5 degrees is to increase the distance to the back wall of the vein. This reduces the chance of puncturing said back wall with the sharp tip of the needle. So, once you have flattened the angle of insertion, the next job is to get the tip of the plastic cannula into the vein itself. Do not at this time attempt to withdraw the needle tip into the plastic cannula. This is the most important bit. Advance the whole cannula with the needle tip still sticking out a further 0.5 to 1 millimeter. After this, the plastic cannula will have entered the vein. As per the previous slide, you have now succeeded in getting the plastic cannula to enter the vein. At this point, you now need to withdraw the needle tip back into the cannula approximately 1 centimeter, as in the picture. Please note that the withdrawn metal part of the cannula now provides rigidity for 2/3 of the cannula, which prevents kinking in patients that have tough skin. Finally, now advance the entire cannula, needle and all, in situ. Do not push and pull. Once the cannula has been inserted all the way up to the wings, you can now withdraw the needle, cap off the cannula and stick it down. All that remains is a discreet fist pump as you congratulate yourself on a successful cannulation. Well done.